Hi everyone, my name is Nicholas Perez. I'm currently a registered nurse working in a med-surg unit. I enjoy spending time with friends and family, playing video games, and being on the water, whether it be boating, fishing, or relaxing at the beach. I graduated with my associate's degree from Miami-Dade College Benjamin Leon School of Nursing in December of 2023. My current goal is to complete the bachelor's program and continue gaining experience in my current position so that I could eventually transfer to an ICU unit and become a critical care nurse. After reading the articles, I learned that a sacred cow in healthcare refers to a long-standing practice or routine that is rarely questioned, even when evidence suggests it may no longer be effective or relevant. These practices persist out of habit or tradition, often without consideration of updated research or evidence-based guidelines. Sacred cows can lead to inefficiencies, wasted resources, or even less than optimal patient care. So an example of a sacred cow in my med-surg unit is changing the IV tubing every 72 hours. For years, this has been standard protocol based on the belief that frequent changes reduce the risk of infection. However, evidence-based guidelines such as those from the CDC now tell us otherwise. Research shows that for most patients, IV tubing can safely remain in place for up to 7 days without increasing the risk of infections, as long as it's not used for blood products or total peritoneal nutrition. This is a perfect example of a sacred cow because it is practice followed out of tradition rather than evidence. This outdated routine wastes time and resources, and it could also cause unnecessary disruptions for patients. By letting go of practices like this and embracing evidence-based care, we can send this sacred cow out to the pasture. So another example of a sacred cow in my med-surg unit is taking vital signs every 4 hours for every patient regardless of their condition. For years, this routine has been treated as standard practice and many of us follow it without question. But in reality, the evidence shows that stable, low-risk patients don't always need such frequent monitoring. So not only is this practice inefficient, it also interrupts the sleep of stable patients, which is crucial for their healing and recovery. Imagine being woken up multiple times a night for vital sign checks that you don't truly need. It's frustrating for patients and could even hinder their healing progress. So by continuing this practice universally, we're dedicating time and resources to tasks that may not add value, rather than focusing on patients who truly need our attention. Adjusting the frequency of vital sign checks based on the patient's condition is more efficient, and it adds to compassionate and evidence-based care. To provide the best care, we must challenge these outdated routines and replace them with practices supported by the latest evidence. So we need to send this cow out to the pasture.